Mesothelioma is an aggressive form of cancer that develops in the mesothelial cells of the lungs, chest cavity, or abdomen. These cells form the thin membrane that lines and protects internal organs. Mesothelioma is usually caused by previous exposure to asbestos. Due to the long latency period of this disease, mesothelioma diagnoses are expected to continue increasing for the next few decades. Unfortunately, mesothelioma is very difficult to treat effectively once diagnosed. The current standard first-line treatment is a combination of chemotherapy drugs such as pemetrexed and cisplatin. However, the median survival with this treatment is still only around 12 months. Clearly, new and more effective therapeutic strategies are urgently needed for this disease. In recent years, DNA damage response (DDR) inhibitors have emerged as a promising new class of targeted anti-cancer therapies. The DDR pathway plays a key role in detecting and repairing DNA damage, helping to maintain genomic stability. Cancer cells, including mesothelioma cells, often have defects or vulnerabilities in their DDR systems compared to normal cells. By inhibiting specific components of the DDR pathway, such treatments aim to overwhelm the DNA repair capacity of tumor cells and force them into apoptosis or senescence. Several types of DDR inhibitors are now in clinical testing either as single agents or in combination with chemotherapy or radiotherapy for various cancers including mesothelioma. One class of DDR inhibitors being studied are PARP inhibitors. PARP enzymes play an important role in DNA base excision repair. By inhibiting PARP, this repair pathway is blocked and DNA damage accumulates, especially in tumor cells that already have deficient homologous recombination repair (HRR). Several studies have shown promise for PARP inhibitors such as olaparib, talazoparib, and niraparib in treating mesothelioma patients with BRCA1-2 mutations, which cause defects in HRR. For example, in a phase 2 study of olaparib monotherapy, 11% of patients with BRCA mutant mesothelioma had partial responses, while the median progression-free survival was 4.2 months. Olaparib is now being tested in combination with chemotherapy in larger phase 3 trials. However, the response rates in patients without BRCA mutations appear to be lower. Another important class of DDR inhibitors are ATR inhibitors, which target the ATR kinase that plays a central role in the cellular response to replication stress and DNA damage during S and G2 phases of the cell cycle. Preclinical studies have found that mesothelioma cell lines are sensitized to ATR inhibition, particularly when combined with DNA-damaging treatments like cisplatin. Several small molecule ATR inhibitors such as AZD6738, VE822 and M6620 are now in early phase clinical trials both as monotherapy and in combination regimens for mesothelioma and other tumor types. Preliminary results suggest they are well tolerated and can enhance the activity of chemotherapy. For example, one study found that 25% of mesothelioma patients achieved stable disease for over 6 months when treated with AZD6738 and cisplatin. Checkpoint kinase 1, CHK1, is another important DDR protein regulating cell cycle checkpoints and DNA repair. Preclinical data shows that CHK1 inhibition leads to premature mitosis and increased DNA damage in mesothelioma cells, particularly when combined with topoisomerase inhibitors. The CHK1 inhibitor prexasertib is currently being evaluated in multiple phase 2 trials for mesothelioma both as monotherapy and combined with chemotherapy regimens like pemetrexed, cisplatin. Initial results are promising, with several partial responses observed. The combination appears reasonably well tolerated with mainly hematological toxicities. One study observed an objective response rate of 24% and median progression-free survival of 5.7 months for prexasertib plus pemetrexed, cisplatin. DDR inhibitors that target specific vulnerabilities in the DNA repair pathways of mesothelioma cells are showing early signs of clinical benefit both as single agents and when combined with chemotherapy. Response rates appear highest for PARP inhibitors in BRCA-mutated tumors, around 10 to 25%, while ATR and CHK1 inhibitors may enhance standard chemo response rates to similar levels. Median progression-free survival for combinations can reach 5 to 6 months. Toxicities are acceptable given the aggressively of mesothelioma. Larger phase 3 trials are still needed, but DDR inhibition is a very promising therapeutic strategy that could potentially improve outcomes over current standard therapies for this difficult-to-treat cancer. Research into predictive biomarkers and rational drug combinations is also ongoing to maximize the potential of these new targeted treatments.